Hi, it's Dr. Sahar Roked here, and today I wanted to give you a few tips on how to improve your gut health. So, a lot of people I know, most people in fact, suffer from some sort of bloating, irregular bowels, pains in the stomach, and or flatulence even, the embarrassing thing nobody wants to talk about, or the other way, burping and wind that way. And the fact is, it's very, very common, and often we don't like to talk about it because we feel a bit embarrassed. And sometimes we go and see the doctor and we're told we've got irritable bowel syndrome or IBS. And sometimes we're given some medication for it, sometimes not. Sometimes we're told to look at our diet, and it's all a bit confusing. So I thought I'd give you a few tips on things that you can do. So the first thing is I would recommend keeping a food diary for a week or two and looking and seeing if your bloating or symptoms are worse after certain foods. So become a detective in your own health and figure out what foods are causing what. Like if I eat this certain thing, do I get diarrhea? Do I get constipation? Do I get really bloated? And then you can omit those foods, or if you choose to eat them, that's fine, but you're probably going to have symptoms after. The common issues are often with things like dairy and wheat. So if people are having a lot of bloating and gut symptoms and it's very troublesome, I normally recommend cutting out dairy first for a couple of weeks, seeing if it makes a difference, and then wheat for a couple of weeks. If you do both, that's fine, but then you won't know what's causing what. Although, of course, you could cut out both and then add a bit of dairy back in afterwards, or add a bit of wheat back in, and then you'd know. So there are easy ways of doing this, whatever works best for you and your lifestyle. So that's the first thing I'd recommend. The next thing I'd recommend is looking at some gut supplements. So you can take things like good bacteria, probiotics, which can help the gut. You can take digestive enzymes, one before each meal, which will help you break down what you're putting into your gut. And you can take things like glutamine, which is an amino acid, which means if the lining of the gut's a bit inflamed, having this amino acid, it's normally in some sort of powder form, maybe once or twice a day, can help reduce that inflammation and help your symptoms. So they're things that you can consider for your gut. There are other supplements as well, of course, that I use with patients, but this is just to give you an idea. Now, if you think your symptoms are quite strong, you might want to consider some testing. Unfortunately, they're mainly stool tests. So it would see if there are any parasites, irregular bacteria. Sometimes a marker called zonulin is raised, which is showing a lot of permeability in the gut. Calprotectin is an inflammatory marker. Can also test for the stomach infection, H. pylori. And actually, I see a lot of people with a condition called SIBO, small intestinal bacterial overgrowth, which is too much bacteria in the small intestine. And this can cause a lot of upper bloating and pain. And that's not a stool test, actually. That's normally done on a breath test. So that's a test I sometimes do with patients and sometimes treat. And if I find someone's got something like SIBO or a parasite, we can use antibiotics to treat it and then rebuild the gut together after over time. Or we can use natural antibiotics, things like oregano oil, things like erva usi, things like berberine, which is a really good one, grapeseed extract. So there's lots of options for treatment to suit what's going to work best for you. Now, if you're going to see your GP, things like peppermint oil can be quite soothing for the gut, and that can be prescribed. And mebevrin is an antispasmodic, and in my general practitioner role, I often use those medications with people. But I also do recommend supplements if they can. So look at your diet, keep a record. Of course, I do food allergy testing, but you don't need to do that necessarily. You could see first from your diet and keeping a diary if you can link the symptoms with what you're eating. Look at supplements to help with the gut, good bacteria, enzymes, glutamine. Look at further testing if you need it. Then a couple of options of medication that you can maybe speak to the GP about. So I hope that's helpful to you. One more thing that's really important, bone broth. You could start making bone broth or buying it, which is essentially as it sounds, like if you make a roast dinner, chicken or beef, you know, boiling the bones up after. This releases a lot of good substances from the bones. These are really healing for the gut as well. So I'd advise you to look at those options for yourself. And of course, if you want any further guidance with it, let me know. And if you think this video will be helpful, please share it with your friends and family. Any comments, comment below or message me directly. I hope you find this helpful, and take care and speak soon. Bye.